We're actually just going to introduce osteoporosis. For those of you who don't know, what is osteoporosis? Let's talk about that. Osteoporosis sounds pretty scary, and to be quite frank, it really is. Osteoporosis in itself is just a term for a bone disease where basically the bone mineral density or the amount of minerals in the bones actually decrease from a wide variety of different things. And we'll kind of touch on a few of those further into the podcast. But when we're talking about bone mineral density, you're probably saying, my bones are made of minerals? Like, how does that work? So yes, actually, there's two very frequent ones that show up, being calcium and phosphorus. This makes up a large amount of your overall bone strength and the ability for it to just be nice and sturdy. Also something you'll find in osteoporosis when defining what it is that it'll be a decrease in bone mineral density, which we just talked about, but also a general decrease in bone mass. And bone mass and bone mineral density are essentially the same thing. Your bone mass is basically how heavy it is, and of course, if your bone mineral density goes down, as in the amount of minerals in it, of course, the mass is going to go down as well, because those minerals have a decent amount of mass, or it's not technically weight, but it's basically how heavy it is. So bones comprised of calcium and phosphorus, and as you'll see later in the treatment section, focusing on a couple of these things to kind of counteract that will help. One of the big things about osteoporosis is that it's very, very hard to detect, and it's kind of a silent killer is what they'll say. So if you are somebody who is at risk for osteoporosis, which we will later in the podcast kind of talk about who those individuals are that are high risk, you should be testing more frequently, and we'll kind of touch on that a little bit later. Just some CDC facts to give you about osteoporosis if you're not aware. Those who have hip fractures have an increased risk of death during the first 12 months after the fracture. So let's say, for example, somebody fractures their hip and maybe they do or do not have osteoporosis, but usually the people who do fracture their hips do have osteoporosis. After that fracture, the chances of them dying 12 months after the fracture increase extremely greatly. So this just shows you how severe osteoporosis can get. It's not just the fact of having osteoporosis and the poor bone health. That's obviously not a good thing. It's what it can lead to. And this permanent disability is something that'll be a reoccurring theme, especially with older adults. You'll see this a lot in older adults, especially older women, and we'll kind of touch on that later. I have one example actually. When I used to work at a senior living community, there was an individual who basically she fractured, I believe it was her entire hip and some of her lower leg, so some of her lower body as well. And what happened to her, she used a walker up until that point. She could get around with a walker. After that though, she literally had to use a wheelchair to get everywhere. And shortly after that, her health declined very, very rapidly, very, very quickly. So it's just one of those things where if you don't take care of it, don't keep up on those checkups, and something does happen where maybe you do have a fracture, it can lead to some very, very unfortunate complications as you go down the road. The really, really good thing that we will talk about later in this podcast is that it is very treatable. There are, of course, some genetic components to this where you might be a little more predisposed to developing osteoporosis just based off the cards you were dealt. However, just like most things with health and fitness, there are plenty of great things that you can actually do to help reduce the risk of developing osteoporosis as you age.